Let's bring in Lark Chiropractic. Hello, doctor. How are you? Nice to see you.
Great.
Lark
Good to see you.
Chiropractic is located where?
125 East Barstow,
Okay.
which is right behind Trader Joe's. Actually, if you could jump over the back fence. Actually, if you could jump
Oh,
over the
you're
back
on that little street back there.
Yeah, Diana.
Okay, great. Now, how long have you been a chiropractor?
I am in my 27th year of practice.
Why did you become a chiropractor?
Actually, when I was younger, we had a family friend who was a chiropractor who influenced me greatly. But we were in an accident in a motorhome one day and kind of got thrown around. And when I woke up a few days later, I was kind of like bent over like this.
How old were you?
9.
Okay.
Yeah. And by the end of the day, I mean, I couldn't even sit up and dress myself or eat. So we went to the family friend who adjusted me, and that was it. I mean, just fixed everything.
Now, when you say adjusting, and this is quite a while ago.
Yes.
When you were 9 years old, I happen to know that chiropractic has changed quite a bit over that amount of time.
Mm-hmm.
What kind of adjusting did he do to you then? Was it the loud cracking and the twisting of the neck and all that?
That sounds barbaric.
Well,
no, yes.
I've been to some that are barbaric. I'll
Yes,
tell you that.
Yeah, we do hands-on, which I really like to be able to feel what's going
Sure.
on, and but gentle. But yeah, he did hands-on also. You have to move the bones to get them off, pressure off the nerve.
Right. Well, I guess I think what I'm trying to say is I've gone to some people that were a little brutal. I mean, it's like they're really rough about it, and it just, I don't know if it was helping as much.
Yeah, well, in every profession there's good and bad.
Sure.
So we take Xrays, so we know what's going on, so we know exactly what we're doing.
Do some doctors not take X-rays and they just go right for the crack?
Yeah.
Right for the adjustment?
Yeah, yeah. It's important because I don't know if you have degeneration. I don't know if there's health conditions that I shouldn't be adjusting and referring out, or if I need to be a little bit different in my technique.
Maybe
what I'm
tumors
doing.
or something.
Absolutely.
I mean,
We often send, when we find things like that, we will send our patients back to their medical doctors for whatever intervention that they need, because sometimes we are the first time we find problems.
Mm-hmm. Well, because someone has a pain somewhere and they think, oh, I'm out of joint, but what's happening is there's something else in there putting pressure on it.
Absolutely.
Yeah.
So we, usually we'll sit down and we'll take a full history, do an exam, take X-rays, because we want to make sure exactly what we're dealing with. It isn't so easy just to go in and adjust.
Tell me about your practice, how you do it.
Well, like I said, when patients come in, we sit down, we take a full history. We want to hear what patients have to say. We're actually listening to them.
Yeah, does that consultation, the talking part, does that help a lot?
Absolutely.
Yeah, I bet it does.
Yeah.
More personable care.
Yeah, well, we walk around in society, we tend to be like, oh, I'm fine. Oh, you can't walk, but you're fine.
Right.
And so we put on kind of a facade of everything's okay, but when we can actually sit down and say, oh, you can't pick up your child, or you can't get out of bed. There are things when it restricts your daily living, but you don't tell people.
That's funny. You said you looked at me and you said you can't hold your child. I talked to the doctor before. My shoulder's been killing me for weeks, man. I'm icing it. I'm heating it. I'm using salves on it to try to make it feel better. And I finally broke it down. The only thing I've done is I'm holding that fat little girl of mine, the 10-month-old right here, and I generally do it with my left arm for some reason.
Yeah.
And is it pulled it out? Is it
More than likely, women carry big purses on one side, kids backpacks. Anytime you do something for any length of time in a bad position, it's going to stretch ligaments and pull the bones out of place and put pressure on nerves. So yeah, you got to be careful.
Let me ask you this. I see it all the time. People out in public wrenching on their necks.
Yeah.
That's not good,
That's
is it?
not good.
And I hear some nasty cracking happen when they do it.
Yeah. The problem is one, they haven't taken X-rays, so they don't know why they're doing it and what the purpose, what needs to be moved. And the problem is most of the time when you do that, when you take something and bend it in half, which is kind of where you're bending your neck, you get the middle. You don't get the top, you don't get the bottom. So you make it hypermobile. It slips in and out of place too easily. But most people, the problem is at the top of the neck or at the bottom. And they're going to just make it worse, kind of make it sloppy in a way, without fixing it.
My dad always used to, hey kids, come walk on my back. Another one probably not so good, right?
Probably not. Again, we don't know. There could be tumors. There could be osteoporosis. There could be things that need to be dealt with more correctly. And
Like a disc or something out of
Yeah,
place rather than just
absolutely.
being a vertebrae?
Absolutely.
But I shouldn't say just a vertebrae, because a vertebrae being out of place can cause a lot of pain.
Absolutely.
Some of them more so than others, right?
Absolutely. Well, only 10% of your nerve fibers carry pain. So you could have pressure on a nerve and not feel it. So, yeah, it's important to get checked because we don't know what's going on. And your nerves don't just go to pain areas, they go to organs. So pressure on nerves can affect how your organs function.
Can I say that I like chiropractic first on a lot of things?
Yeah.
Because I feel like the medical doctors, as you call them, the medical doctors want to fix me with the painkillers and the muscle relaxers and that kind of stuff, which I'm not really into.
Yeah. Well, the problem with that, it's like your car. If you put a piece of tape over your red oil light, you're kind of ignoring it. You know, there is definitely a place for the medical profession and medication, but to go to it first, you know, I recently read some research. There was a 7-year study done that when chiropractors were the primary care provider, it reduced medication use by up to 85%, hospitalizations over 50%, the number of days stayed in the hospital over 50%. And
No wonder doctors don't like you guys.
And surgery, 50%. Yeah.
You know, is there a stigma? Do the medical doctors look at the chiropractors as
Well, you know, there used to be, back in the 60s, the AMA actually had a committee on quackery, and they said don't associate with chiropractors. And yeah, and there was an antitrust lawsuit, took 17 years, chiropractors won, and then they appealed, and we won the appeal. But I think most medical doctors today that realize if it's in the best interest of the patient, you know, they don't want a patient that's always coming in hurting, and they can't help them.
Right.
So hopefully, you know, they're open to the, you know, we have quite a few that are open to the fact that, hey, you know, if I can't help you, I don't want to keep hearing you hurting all the time. This might be a good way to go.
Now, how does insurance feel about chiropractic?
Well,
They cover it?
it depends on what insurance you're talking about. Obamacare, no. In California, when they passed Obamacare or Affordable Care Act, they said what is essential per state, and California did not choose chiropractic to be essential. But work comp system, you know, Medicare, I mean, that's federal. It is covered because it is recognized we are primary care providers. But unfortunately, cost cutting, they will cut chiropractic. But chiropractic is cheaper, so it doesn't make sense.
But there's no prescription drugs involved, doctor.
Exactly.
Okay, so tell me what you have there.
Oh, I brought a friend. This is a spine, and obviously this is what we work on. And one of the things that I want to talk about today is why we need to look at the spine, because, you know, we can't replace our spine. If we don't take care of it, we're in trouble. And one thing that's becoming more and more prevalent is text neck and being down like this.
Text neck.
Text neck. Yeah. I know you see people all the time that are just bent over. Problem is we have a curve in our neck, curve in the mid-back, curve in the lower back. And these curves, they balance the spine. But when you're on the computer or on your phone all the time, you're like this. And I know you see people that have that.
And it tends to stay like that after a while?
Yeah. You know, you ever lay too long in one position, you go to get up and you're like, oh,
I've never laid too long in any position.
The ligaments and muscles, they stretch. But you know, you see people that have that hump back there.
Sure. And what would a chiropractor do?
Well, if we can get the vertebrae moving back to where they should be, and we can work on the alignment and work with the patient with exercises and other things to restore curve, it's going to balance the head back over the body and take the pressure off. Because when you have that head forward, it's like walking around with a bowling ball in front of you all day. It's going to hurt. It's going to make your shoulders hurt, your neck hurt, and even your low back because you're kind of counterbalancing it. So it creates problems everywhere, not just the neck.
I'm happy to hear you say stretching and stuff like that. I think it's easier to say, let's make your next appointment. But
Yeah.
you know, if you're putting some stretching into the whole rehabilitation.
Yeah, we actually do a lot of rehabilitation because, you know, active movement is so much better for you than passive. If we just do therapy, sometimes that's necessary to get things going and to help reduce inflammation and help the adjustments go better and your healing to speed up. But if you don't do exercises and stretching, you're never going to have long-term results that stay.
Awesome. Okay, you're over off of Barstow.
Yes.
On Diana?
On Diana.
Okay, you want people to call you, go to your website? What's the best way?
Ooh, they could try either.
Okay.
Our website's larkchiropractic.com. Our phone number is 221-6234. They can see about us, read about us, get more information. Either way, phone or website.
Dr. Lark, thank you for coming by. Nice to see you.
Thank you so much.
Go to see Dr. Lark and tell her you saw her right here on The Buzz. We're going to take a quick commercial break and we'll be right back. Stick around.